So we did a study that was recently published in Hematologica that we kind of characterize the outcomes on the genetic dynamics of patients with a first relapse with AML. Firstly, we did an analysis of the genetics dynamics, and what we showed is that the majority of patients that they relapse maintain the majority of mutations that they had at diagnosis. But there are some mutations that tend to disappear, like those with those mutations involved in signaling of the cell, like FLT3 or JAK or RAS. And then there are other mutations that tend to persist, like chromatin modifiers or TP53. And also, when we compare these dynamics of mutations and comparing patients treated with intensive or low-intensity chemotherapy, we see that patients treated with intensive chemotherapy have a higher incidence of TP53 at relapse, most likely because of clonal selection induced by the chemotherapy. And then we also showed that these patients had a worse overall survival, and actually the only factors that were predictive for survival in our cohort was the time in remission, also the complex cytogenetics, and the white blood cells elevated.